Obama repeatedly told us this.
Let me be absolutely clear about what reform means for you. First of all, if you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan. Nobody is talking about taking that away from you.
Well, Mr. President, turns out that's not exactly the case. Just today, we saw a number of headlines highlighting the true costs of Obamacare, but none more striking than the New York Times, which writes that the only reason premiums may decline for some is that many insurers are significantly limiting the choices of doctors and hospitals available. All right, let's talk with two experts. Joining us now, Dr. Bill Grace, founder of Grace Oncology and assistant professor of clinical medicine at New York Medical College, and health policy expert Betsy McCaughey, author of the book Beating Obamacare. Betsy, begin with you. I was pretty surprised at this New York Times. Lower health insurance premiums to come at the cost of fewer choices. So let me get this right. They've narrowed the base. They've narrowed the base of doctors, hospitals, and other health care providers, and other to keep premiums down. But what if you need better coverage? What are you going to do?
What the insurance companies have done is this. They saw that premiums were going to have to really spike for several reasons. So to keep them from going even higher, and in the 16 states that have announced premiums, they're up 24% over last year. But to keep them from going even higher, insurance companies are paying the doctors and hospitals that participate in these exchange plans much less than they're paying doctors and hospitals in commercial plans. So it's really like Medicaid with a private insurance name attached to it. And because they're paying the doctors and hospitals bargain basement prices, fewer doctors and hospitals are willing to participate. Right. So in California, none of the University of California hospitals, nor Cedars-Sinai, the Prestige Hospital in Los Angeles, is willing to participate. And in many, many other parts of the United States, the premier academic hospitals say, we can't do this.
All right, Dr. Bill Grace, two things going on here that interest me. One is the reimbursement rate. That's what the Cleveland Health Center talked about. They had to lay off a lot of workers and cut costs. They don't believe they're going to get reimbursed. That's your Medicare, Medicaid problem. But the second problem is this. As advertised, the idea, one of the big ideas for Obamacare is that people with prior illnesses would get insurance. But really, when you read this New York Times article, if you are ill, you have such narrow choices that you're going to have to go out of network. And if you go out of network, it is going to cost a bloody fortune. Now, that is a direct contradiction to one of the big selling points of Obamacare.
As I mentioned last time I was on your show, the numbers do not add up and will never add up. You just can't make something like that out of nothing. The other thing, Larry, is nobody's ready for this. You know, there's a perfect storm coming come January 1st of next year. First of all, no one's ready today on October 1st because today, 35 of the 50 states, we can't even get the software to determine if you're an employer or a physician or an individual person what your subsidies are going to be to make a decision on what plan you want.
But we don't know that. We can't verify the income levels.
You cannot verify that. And on top of that, you know, most of this is going to fall on primary care specialists.
Right.
And what's happened is we are already $15,000 physicians too short. And right now, with the perfect storm coming, Obamacare and the ICD-10 codes, these codes are going to make chaos.
What's an ICD-10 code?
These are the new codes, the European codes that tell you whether you code somebody if they've gotten bitten by a rat or bitten by a horse or bitten by they're chaos coming down the track.
I want to go back, Betsy. I want to go back to this point, though, the New York Times article, because coming from the Times, it's big news. All right.
Although other newspapers covered this months earlier, the Los Angeles Times, for example, covered this many weeks ago.
But Dr. Bruce Siegel, the president of America's Essential Hospitals, which was formerly the National Association of Public Hospitals, that's a big deal. He says insurers are telling his members, quote, we don't want you in our network. We are worried about having your patients who are sick and have complicated conditions. Now, this goes back to my other point. One of the selling points of Obamacare is people with prior illnesses would get taken.
They're also going to get clobbered for this reason.
But these guys are saying that the insurance companies won't let the proper providers into the system.
They don't want to pay them enough. But in addition, the seriously ill people and many of the big disease advocacy groups like the American Cancer Society, Juvenile Diabetes, they all pushed for Obamacare. But now the president has removed the cap on out-of-pocket expenses. So suddenly the seriously ill people, as Dr. Grace pointed out, are going to get clobbered the hardest because they're going to have to go out of network for the expert care, and there will be no limit on how much they have to pay.
How do you solve that? How do you solve this? You have to have some kind of, I think, federal state risk pools to help those who are seriously
That's what we had in 35 states before Obamacare.
That's right.
Just tell me how to solve that, because this I find troubling. It not only undercuts the selling point, okay, but more important to the people who are ill and who get into this system and who find out the system doesn't help them, and then they're going to have to go out of network and they're going to get clobbered financially. How do we solve that problem?
Well, right now what you're going to have is another sort of a super Medicaid program. Not Medicare, Medicaid. And with this super program, who's going to take care of you? They're going to be taken care of by the interns, the residents, and you hope they're supervised.
But how to solve it, Larry? We were solving it. 35 states in the United States already had publicly subsidized high-risk pools for the very people we're all worried about.
What happened to that?
Seriously ill patients.
What happened to
They're
that?
being supplanted by Obamacare, and the seriously ill are going to suffer the most.
You mean they're being replaced? There's no
being replaced.
Overrules.
Right, absolutely. They're being replaced. In addition, of course, everybody got bamboozled by the claims that there would be so much choice. You arrive at that exchange on October 1st, it's like going to a supermarket that only sells cereal.
The shelves are bare. The shelves will be bare.
The shelves will be bare.
I get you. That's one of many reasons why the individual mandate should be delayed.
Yes.
Should be delayed, and let people come back and take a look at this thing again. All right, Dr. Bill Grace, Betsy McCaughey, thank you.